I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about family medicine and midlife and all the different transitions that we have in our lives. Before we get into it, a few things I want to make very clear. One is that I'm definitely not giving any type of medical advice. If you have any questions about your health, make sure you go speak with your healthcare provider. And this is definitely not any advice about your religion. So if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I'm super excited to have on with me Dr. Brittney Anderson. And Dr. Anderson, if you could please introduce yourself to the viewers and the listeners out there.
Okay. Hi, just as you said, my name's Brittney Anderson. I'm a family medicine physician. I grew up in Alabama, went to Duke for my undergrad training, came back to Alabama to do medical school training, and am here now practicing family medicine. I do a little bit of everything. I tell people I will do anything at this stage of my career except deliver a baby. But I am practicing in rural Alabama, and we actually just lost the labor and delivery unit at our hospital. And so I literally drive around with an OB kit in the back of my car. I don't plan to deliver a baby, but if I had to, I could. At some points, it gets to where it's either me or the state troopers having to deliver on the side of the road. And I hope it never comes to that. But I'm family medicine trained and well trained to do a good variety of things. So I am in private practice here in Alabama, 3 years into private practice and loving every bit of it. Switching from employee to private practice is hands down one of the best things I've done in my career. And I'm just loving taking care of patients here in my little area of the woods.
That's amazing. Well, first and foremost, thank you for being on with us. And secondly, I'm so sad to hear that you lost your labor and delivery unit at your rural hospital. I mean, that's just awful because I know that, first of all, women have such a hard time finding OBGYNs and now they have to become these reproductive refugees trying to find care. I mean, that's just awful, right?
It is awful. It is an issue that we're facing all across the state in Alabama. I sit on several maternity workforce shortage task force, and they really are all about how can we, one, reopen some of these labor and delivery units that are closing at our rural hospitals, and how can we get OBs, even if it's family medicine docs who do OB, into these areas. Because my patients, I had a patient come into me, positive pregnancy test earlier this week, and it is, all right, let's find you a doctor in Tuscaloosa. And Tuscaloosa is an hour and 15 minutes away. And so remembering what that schedule looks like, I mean, obviously, you know better than I do, what that schedule looks like of what those follow-up visits need to look like and what those prenatal visits look like, asking patients to have to travel not only for those appointments, but also at the time of delivery. And so many of our patients are high risk to start with, right? We live in an area where we have a lot of diabetes and hypertension and all those things that already put women at high risk during pregnancy and especially during delivery. And then to ask them to have to drive, an hour, 15 hour, 30 minutes to deliver is insane and is one of the issues that so many physicians and task forces in the state are trying to address. But we are begging our legislators for help, for bigger systems to come in and help because this is a problem that we're seeing all throughout the state that labor and delivery units are closing, and it's unfortunate.
This is just absolutely awful. I mean, just listening to you, I'm just trying to think of like, those appointments, they're like every 4 weeks, and then we go every 2 weeks, and then every week. And then, gosh, I mean, anything can happen, right? Yeah, a woman can break her bag of water. She can have vaginal bleeding. She can have hemorrhage. I mean, gosh, it's just like it's stressing me out just thinking about not having anyone there. Yeah, OBGYNs are so underrated, we do so much and we literally save patients' lives. And I feel for your patient population. I just think that that's awful, right? Just uh, anyways, gosh. Well, I hope they are able to come to some, and what about your state? Does it have very restrictive laws on like abortion and all that stuff too?
Yes, absolutely. We are in Alabama, and you can imagine, just as with many other things. We are very restrictive in a lot of those things, and access to abortion is certainly one of them, and has been one for some time. And so that just adds on another bit of complexity to this as well. So it is a tough time and has been for years, but it's just getting a lot tougher for women to be at their best health in the state because of issues related to their reproductive health in general.
Yeah, I mean, that's just so saddening to me. I just think that, it's just first of all, they make it so difficult for OBGYNs, right, to just even practice medicine. And then, well, then they wonder why the OBGYNs are leaving. Well, if you're going to jail them for providing care to their patient population, then why wouldn't they leave? I mean, listen, everyone has to, provide for their families. And how would you provide for your family? You're going to try to take care of your patient, and then you get jailed, and then just what a disaster. I
It is
mean,
absolutely a disaster between the OB-GYNs and the few reproductive endocrinologists that are here, were here in the state. I mean, we're seeing a good bit of an exodus to states that are a little bit more friendly towards those things. And it really is. It's unfortunate for those physicians who are having to uproot their families or change the way they were trained to practice or that they want to practice, but it's also devastating for our population, our communities.
yeah, I mean, it's just nothing makes sense. And the problem is that we have lawmakers that are not in medicine, that do not understand medicine, making laws on women's bodies that they have no right to be doing, right? I mean, it's just how frustrating, how just really disheartening for women there. And just, I mean, you as a provider trying to find care, anyways.
It's
Well,
a lot.
I'm sorry to hear that. Hopefully, yeah, I it's a lot for the physicians out there, physicians like you who care so much for patients, it's really disappointing.
That I think about our ER docs here still at our hospital. I mean, the hospital's still open, and they are literally terrified that a woman is gonna come in labor ready to deliver with with something bad going on because they're not trained to do it. So that certainly is
Yeah.
something that's always there. Yes,
I
that's
mean,
where we are.
OBGYNs, we're trained to handle all these emergencies, right? Like preeclampsia, shoulder dystocia, hemorrhage. People don't understand. People think like our jobs are like so easy. We just catch a baby and we're done and woohoo, we're like these glorified cheerleaders and we're really not. I mean,
At
we
all.
do a lot. We do a lot. And it's as an OBGYN, I highly respect this profession. I mean, it's no joke. It really is not. So anyways, as a family physician, you care for people across every stage of life. What drew you to family medicine, and how does that lens shape the way you support women in midlife?
Yeah. So throughout my training, I loved the variety. And I went through, we all go through our medical school training and you do a couple weeks in OB-GYN, a couple weeks in, neurology, a couple weeks in pediatrics. And I found that I liked a little bit of everything and liking a little bit of everything and not wanting, so much monotony in my day, but wanting different experiences with each room that I open. And I know that that's there in other specialties, but it really drew me to family medicine. I love the idea that even in my practice right now, in one room, I can be seeing a 2 week old newborn who's there for a follow up visit from the hospital, and in my next room, I may be seeing a 94-year old. I don't find myself getting burned out or overwhelmed because I'm just doing hypertension management all day or diabetes management all day. But I see, some kids and do well kid visits and really get that variety in the day. And I love that. And that really is what drew me to family medicine. To the question of how does that shape the lens of what I do with treating women or supporting women in midlife, I think that's so much of it. I'm fortunate that I get to see women at different stages of their lives, and so whether that's me seeing younger girls in clinic, then seeing these adolescent teenage females in clinic, and then seeing women who are at midlife and those who are later in life, it really gives me that full scope and the full idea of what life looks like for women. And so that has been a really great part, just watching that progression. That is just a natural part of my practice.
Yeah, it's amazing. Now you've seen generations within families. That's kind of what you were talking about, right? That you get to see grandmothers, mothers, daughters. How does that perspective help you to understand women's unique age, unique health needs as they age.
Yeah, so it really gives me perspective, I feel like. And it gives me perspective because there are times, like even today, I saw a mom and a daughter in the room together. Now, granted, the daughter was in her late 50s and mom was in her late 70s, but I can
Wow.
kind of slowly start to see, daughter becoming mom, right? And I can see
Yeah.
their mannerisms are so similar, and they'll talk to me about childhood, and mom will talk to me about raising the daughter. And so I love to see generations at a time. And the beauty is that I do have generations in clinic. I've got, up to four, I was thinking about it earlier, up to four generations of family in my clinic of women that I see, to the smallest
Amazing.
baby who's a couple weeks old to grandmother who's in her great grandmother who's in her 80s. And I love that. And again, it helps me when we think about things, especially like menopause or perimenopause, or, questions that we ask patients about their family history. I'm seeing the family history because I'm there, right? And so I'm
Yeah.
asking the questions about, breast cancer screening, any family history of breast cancer. And yes, I'm still asking that question, asking it aloud, but where I am and where I practice, especially, I can ask that question, but at the same time, I'm taking care of mom, I'm taking care of aunts, I'm taking care of grandmother. So these things are still in the back of my mind already. And so I love that part about being able to see generations of families.
That's amazing. I don't know of any doctor that can say that they see generations like that, right? So that is really the amazing part about family medicine is that you can see, a baby and then the mom and then even the dad, right? And then you see all families and all that really is phenomenal. I mean, there aren't very many specialties that can say that. So you're absolutely right about that. So what are some of the most common struggles you think women bring into you during their perimenopause, menopause years?
Yeah, so much of what I get in my practice is the hot flashes and the mood changes, right?
Yeah,
As
yeah.
women, but even there are times, and I smile at it a little bit when I think about it, but there are times that husband comes in or partner comes in with them, and they are like, "Dr. Anderson, you have got to do something."
Yeah.
Gonna run me out of the house because with, mood changes and that, or she's gonna freeze me out of the house. One or the other. What are we doing here?
That's so true.
Yeah, and I think it's so cute, and I say, "Hold tight, hang tight, we'll work out a plan here." But those are the 2 more common complaints that I hear, or concerns that I hear from women. I won't call them complaints, concerns that I hear, from women related to those perimenopause and menopause, symptoms that come. But so often, they're things that they don't readily realize could be related to perimenopause. I had a patient just earlier this week who gave me a line that was something like, I'm tired all the time, but it's just one of those things that comes with age. And I'm like, hold on, it doesn't have to be one of those things that comes with age. Like maybe we back off a little bit and take a step back and start thinking through, are there other things that it could be? And so a lot of what I do and a lot of what I know you do as well is taking those words that patients give us and turn it into, okay, let's think through this. Maybe it's not just something that's supposed to happen because you're aging. And that's with a lot of things, right? Maybe it's not just an aging thing or something that we chalk up to stress or not get enough sleep last night. Maybe it's something else that we really need to dig into. So, but yeah, but hands down, when women come in with the thoughts of perimenopause, perimenopausal symptoms, usually they're talking to me about hot flashes and mood changes.
Yeah, yeah. So, how do you help women that say they don't feel like themselves anymore, but don't realize that it's those hormonal changes and that's why they don't feel like themselves?
Yeah, so absolutely, and that, like I was just saying, is a lot of it that they'll come in and this patient that I think of from earlier this week who was like, I'm tired all the time, and she said, well, I guess that's just a part of getting older, and it is
Yeah.
that taking that step back and saying, you know what, that absolutely could be it, but there's a list of other things that are going on in my head that make me think maybe it could be something else. And so one of the things that I love to do with my patients is I will talk to them out loud. I will work through that differential diagnosis that's going on in my head, and we'll talk through those things. And we'll talk through, could this be related to your thyroid hormone and having abnormalities there? Could this be anemia? So we run through this full list of things, and I say if we get to the end of this list of things and everything that we've done, workup wise, treatment wise, all those things are negative or we get no benefit, then okay, then we can say this is just chalked up to you not feeling like your normal self or you being, more tired. Maybe it's related to stress, all those things. But if not, then if we've got something in front of us, let's treat it. If this is something that's going on enough that it's bothering you, then let's find a solution for it. So I really do. I try to think through those things when a woman comes in and not just leaving it at that. And that's something that I'll be honest with you, it's easy to do. It's easy to leave it at that. Oh, I just don't feel great today, and move on to all right. Well, let's talk about your blood pressure, your diabetes, your cholesterol, and all those other things. But it's really being in tune to my patient and knowing my patient and knowing when to slow down and say, okay, let's address that thing that you just said in passing and not skip by it.
Yeah. Yeah, and I think that it's so hard, right? Like, as a family physician, you're dealing with so many different aspects of their life, right? Like, their medical problems, their social problems, this and that, and so, I'm wondering how you navigate picking out the most important symptom, right? Like, they're coming in for, like, diabetes management, hypertension, and then at the end, of course, as you're, closing your you've got your hand on the doorknob and you're about to go, they're like, "Oh, by the way, my libido sucks
Yeah.
and,
Yeah.
I'm not feeling like myself." So
Yeah.
what do you do?
Yeah, I'll tell you, those are one of the things that I try my best. It does not always happen, but I try my best to not let happen in my practice. And the reason I started this maybe about 2 years ago is really walking into the room and setting the tone for that visit, right? And so I'll say, this morning I was looking over all my patients who were going to come in today, and I know we've got to talk about your diabetes. I know we've got to talk about your high blood pressure today, but what else do we need to talk about? And sometimes they'll give me the full list of things, and sometimes they'll say nothing. And I push a little bit more. Are you sure there's nothing else going on that we need to talk about? And so sometimes that allows me to set that stage from the beginning. So I already know what we're gonna, what's gonna come up. But you're so right that sometimes that, hand is on the door. I'm asking if there's anything else as I'm standing up, and then boom, I get it. Hey, let's talk about this too. And one of the things that I love about the way I'm able to practice now that I'm in private practice is that I can say, you know what, I know I've got other patients who are there, but this is someone who otherwise never tells me anything else is going on. And so the fact that, this patient has enough of an established relationship with me that they feel comfortable saying, hey, something's off with my libido, or I'm having, pain with intercourse or something like that, tunes me in to say, all right, let's sit down and talk about this because this is, we have a relationship with each other and this isn't something that's come up before. But you're absolutely right that with so much going on with our patients who, have significant chronic conditions and many chronic conditions, it sometimes is hard to add one more thing into that visit that we need to talk about. But important that our patients realize that that's their right to be able to bring up what their issues are and that they should be able to get them addressed.
Yeah, yeah. So, like, we know that family physicians are often the first point of contact. What questions you think that patients should ask their doctors if they're in perimenopause or menopause and feel like they're not really being heard, that they're just being dismissed?
Yeah. I think sometimes the leading with those things, right? So, that yes, even if you're going in for a regular checkup or going in for your diabetes or hypertension, go ahead and plant that seed with your physician early, right? Like, yes, I want to talk about those things, but can we also, before I leave today, talk about this thing that's going on as well? Because if we let it stay and let it kind of sit in the back of our minds, and then the visit is almost done, and then we bring it up, then you're right that sometimes you may get some docs who say, you know what, let's talk about that next time. So, one of the things that I would encourage women who have these concerns and want to address them or feel like they have brought them up before but are not getting anywhere with them, maybe change the way that maybe change the way that process goes and bring that up early in the visit. Another thing that I tell folks all the time, I tell my patients, if we have an interaction, if you have an encounter with me and you feel like I'm not giving you what you need, I am not the only doctor around, right? And I encourage patients, I encourage my family members, I encourage friends. If you're not getting what you need from the physician who is supposed to be taking care of you and addressing your needs, there's nothing to say that you shouldn't go find another one, especially if it's, something that's going on that really is concerning to you or even, debilitating for you.
Yeah, yeah, no, I think I like that you give your patients options, right? Because they need to know that, they can definitely ask questions, and if they feel like they're still not being heard, then, obviously they have the option to find somebody else that they
Right.
perhaps will connect with. So, sexual health, as you know, often gets overlooked in primary care, but really, I think in most specialties. How do you create space for those conversations with your patients?
Yeah, I think it's all about just creating a good relationship, right? So creating that
Yeah,
rapport and creating an environment where patients feel comfortable talking to you about things that may otherwise seem, taboo or not appropriate to say. And I see that in my practice with both men and women, right? So I see it with men who want to tell me that they're having erectile dysfunction, but will kind of skirt around it a little bit. So I've just started asking myself, right? So if someone's going to break the ice, then it's me. I'll break the ice and I'll ask the questions. And sometimes that does help to begin that discussion a little bit better. I may do that a little bit better with men than I even do with females, just from experience. Men are less likely to tell me, but I realize now that women are less likely to tell me as well. I think about a new patient that I had a couple months ago, was new to me. We were just establishing care, came in. She, had nothing going on, no diabetes, hypertension, no cholesterol issues, no family history, a fairly young female. But we talked for a little bit and I kept saying, is there anything else you want to discuss? Anything? And she kept saying no. And so we just sat and chatted for a while. And then she said, well, Dr. Anderson, can I really tell you why I'm here? And then we got into what she wanted to talk about. So just pain with intercourse, issues within her relationship related to sexual intercourse. And so we started talking about that, but what I realized was that is what she came in to talk about.
yeah,
She was really just kind of filling me out, seeing if she felt comfortable with me sharing this. And so I think as physicians sometimes, especially in certain specialties, that we get a little bit wrapped up in getting things done, addressing what's in front of us and then getting up and getting out of the room. But it's so important that we create those safe spaces for patients to be able to open up and ask us things that they may otherwise feel like they can't ask or shouldn't ask.
yeah, absolutely. So, what screening or habits do you think are most important for women in their 40s, 50s, and beyond?
Yeah, so I mean, of course, getting your mammograms done, getting colon screening. I'm a big proponent of women getting their colon screening. Of course, numbers, guidelines have changed for age wise. And for those without any family history of colon cancer, they should be starting their colon screening at age 45. Breast cancer screening, so getting regular mammograms done, coming in, getting their pap smears done as well. All those things become really important. I really encourage also those baseline labs and getting regular screening labs. So it's one thing that when we, hear so much about cervical cancer and breast cancer and cancer screening, and absolutely we need to be doing the tests that screen against those things. But when we think about the number one killer in women, we cannot leave out heart disease, right? And
Yeah,
so it's so important that women are getting, their cholesterol levels, especially after age 40, getting their cholesterol levels checked yearly, getting metabolic panels so that we're able to look at, kidney function, look at electrolytes, look at glucose levels, getting an A1C checked regularly. All those things become just as important as those screenings that we do to detect and prevent against cancers as well. So I do really encourage women to at least once a year, you need to be going to get a checkup, and that checkup needs to include getting some labs drawn.
yeah. So, what do you say to women who feel embarrassed about bringing up intimacy issues, but are clearly struggling?
Yeah, I say just do it. I think about that patient that I was saying earlier who, the whole time I kept, and I didn't know what the thing was that she wanted to tell me. I couldn't even have thought about what it would have been related to. But it was are you sure there's nothing else you want to talk about? Anything else you have going on? And when she told me about it and we started just to chat back and forth, I could literally almost feel like relief come over her because it was all right, let's work through this.
Yeah.
Let's figure out what resources we have, whether they're even if they're not in our community, resources in the next town over or bigger town over that we can find, what you need. And I look back at that 6 months later and it's night and day. And so when, this female comes back in, I can hear her at the front desk telling the receptionist that no, she doesn't need a visit with me, but can she talk to me for just a few minutes? And I already know that it's for her to be able to tell me that she is in a much better space and much more comfortable, both physically and mentally, just being able to have sex with her husband, right? And so that experience alone has really helped to kind of key me into, not just asking men about erectile dysfunction and what their sexual health is like, but really making sure that I'm asking my female patients that too. And even if it's not just those who are around the age of perimenopause or menopause, but asking, our younger females and certainly older females as well.
What I think is fantastic is that you are actually seeing the couple.
Yeah.
So you can see that couple dynamic, right? Like, so if you help a woman who may be experiencing some type of female sexual dysfunction and her partner who may also be having some type of sexual dysfunction, you're able to see once they get the proper treatment and whatever, whatever else they need, you're able to see that in real time, how that is impacting their relationship and their life.
And absolutely, and to see that in real time, it makes it so much more worthwhile. It makes what I do so much more worthwhile because you literally are watching at a couple, and especially the times that I've seen woman by her wife by herself, male by or husband by himself, or whatever that relationship looks like, and then to see them, together in clinic, or even we were in a small community, see them together out in public, right? You just see that whole dynamic of that relationship change when that part of it changes.
Yeah, I'm sure it must be so fascinating for you, and you must feel so happy, right? Especially because you can see it and you know that how important, sexual health is in a relationship, and when you're able to help them, it really impacts everything in life, right?
Absolutely. Absolutely,
Yeah.
absolutely.
Yeah, so how can women think about their long-term health goals, not just surviving, but staying active, sharp, and joyful well into their later lives?
Yeah, and later that's right, and I tell my patients, that's the goal, right? The goal is to live long and be fruitful and to have a good life while you're here, and so we really do push, in our practice. I know so many docs to kind of those lifestyle modifications that we want people to make, and to make. I don't love the idea of diets and things like that. We talk about making lifestyle changes, changes that are sustainable for long term, and so we talk a lot about exercise, about dietary habits, and with women, especially as we age, making sure that we're getting, plenty of protein in our diet, but that we're also building muscle mass, right? And that it's not enough just to go out for a walk every now and then, but think about getting some strength training in as well. That doesn't mean you have to, hit the gym and be doing hardcore weights, but things that you can do at home that are good for building muscle mass becomes so important. And so we really do. We push for healthy lifestyles in general. I talk to my patients about making sure their water intake is good, that they are getting good regular meals through the day instead of snacking all throughout the day, and again that they are changing up what their exercise routine looks like. So they're both getting some cardio and getting some strength training in, and then also just that they are keeping up with their regular checkups and their regular health follow up. I love the idea of setting goals. It is one of the things that we leave a little piece of paper in our waiting room for our patients to grab that, says what, they put on the line what their health goal is. They write three things that they're going to do to meet that health goal. And then they write the one person who's going to hold them accountable to meeting it. And I tell them to go home and put that on your refrigerator and make it happen. And once you've met that goal that's there, you come pick up another slip of paper out of the waiting room and do it all over again. But I certainly believe that when we, write our goals down, when we say them out loud, and when we tag somebody else into it to hold us accountable, then that's really how we work to hit goals, whether they are health related or, anything else.
It's amazing. I love the fact that you, really empower them to take action. And it's not just all, kind of just lip service, but that you actually want to make sure that they, actually do what they want and really are trying to help them achieve their goals, their health goals. And I think that's fantastic. So you see so many sides of people's lives. What's one memorable or let's say heartwarming story that you have that has stayed with you as a family physician?
I am still seeing in clinic now a young lady that I delivered as a medical student. And so I delivered her as a medical student in the hospital service. I'm now an hour and a half away from where I was then at the time that her mom delivered her. She had some kind of family changes that are different. And so she lives with an aunt now. I took care of her when I was a resident. So in my residency training. And so when I left that area, she was 4, and about 2 years ago, they found me again here, now an hour and a half away from where they live, and I'm her regular, primary provider. And so, delivered her as a fresh-faced medical student who knew nothing about delivering babies, but got to take care of her as a family medicine resident in the well baby nursery. And now I'm seeing her as a teenager, and it's just so
Oh
fun.
my god.
I know, isn't that crazy? To just see
That
that full spectrum, and to know that they, think enough about me that they will drive an hour 20, hour and 30 minutes for her to come still see me as her regular physician. And so I love that. And so maybe not a specific
that's
story, just
amazing.
something that really, really touches me and really speaks to the continuity of care that I hope to provide. Again, delivered her as a medical student, and so to still be able to see her now as a full attending in private practice and just watch how she's grown so much is it's everything to me.
Aw, that's amazing. I love that story. I can't believe you've seen her since that tiny person, right?
I know it's incredible to watch. I have so much appreciation for OBs. I said I like to do a lot of things, but delivering babies was something that honestly terrified me as a medical student. And
Yeah,
so she
very
is.
scary for sure.
Yeah, exactly. But I love that I delivered her and now get to watch her grow up as I continue in my practice as well.
That's so amazing. I love that. I love that. Actually, I'll have to say that's actually one of my most favorite places, actually, not places, but things about being an OBGYN is seeing the kids that I delivered. And then they'll come up to me and be like, "Oh, you delivered me." Or they say, like it's so sweet, right? Because their moms, their parents will be like, "Oh, she delivered you," and it really is a special bond that you have with a person. I have actually a patient that I delivered back in 2005. And what happened is that she was told to get an abortion because they thought that the baby was not growing and it was going to have some heart defects and there wasn't enough fluid in the uterus and this and that. And so I remember the mom asking me, do you think I should get an abortion? And I said, it's up to you. This is what, the ultrasound is showing, but it's up to you. So she said, no, I have faith in God. She's very religious. And so she's like, no, I have faith in God. I just know that it's going to be okay. And so, really, I mean, it's one of those very rare stories. I will tell you that she ended up keeping her baby and the baby grew, she accumulated more fluid, the baby was okay, and then at 35 weeks, she went into labor, and she was a previous C-section. I happened to be on call,
Mhm.
and so I did her C-section, her delivery, and I see her now, her baby is 20 years old, and I see her at community events, and she always comes up to me and says, mom always says, "You remember, this is your doctor." So it's really sweet. It's a very sweet bond,
That is
when you
so
actually yeah, yeah, when you get a chance to, be a part of somebody's life in that way, it really is, really special
that's
that
awesome.
not many people can say that they've done?
Absolutely. That's incredible.
Uh, yeah, so if there was one simple health message that you feel like every woman should have on her fridge, what do you think it would be?
Find a doctor you're comfortable with, right?
Yeah,
Is it.
for
That is
sure.
that is it. And whether, for women, maybe that's 2 doctors, right? Maybe it's your family medicine doc and your OB-GYN, right? But find a doctor that you're comfortable with, that you do not hesitate to tell when something is going on in your body. I tell my patients that, yes, I went to medical school, but you live in your body. You know your body much better than I do. And if there's something wrong or something that you're concerned about, just know that you know your body. And if there is a concern there, you feel like your concerns aren't being heard, keep digging, keep seeking until you find somebody who will answer those questions that you have and who you feel like really have your best health and your best interest in mind. So that'd be what I'd say.
Yeah, absolutely. I think you're 100% right. Is definitely find somebody that you're comfortable with, comfortable talking to, and that is not going to dismiss you and actually listen to you, right? Sometimes we only hear what we think that person is saying, where we don't actually listen to what they're saying. So I think that's really important. And any other pearls or anything else that you feel that people should know as they navigate, their life with a family physician, whether it's adolescence, it's, their reproductive years, it's perimenopause, menopause. What do you think is, aside from actually finding somebody that will listen to you, what other things do you think might be really helpful for women as they navigate their life?
Yeah. And so again, so one, finding that physician that you trust and that you feel like will listen to you as well. But also to take charge of your health also. Take charge of your
Yeah.
health. I love the idea of going into an appointment with questions. Go in with questions, leave with the answers to those questions, right? And so I tell women of all ages, I tell this to my adolescent, patients who come into clinic, with my older patients, et cetera, to go in expecting to get something out of your office visit, especially when it's you seeing your primary care physician, right? So go in with a plan to get something out of it and leave with that thing. And so really that gets back to kind of setting those health goals and knowing what you want in life, but doing those things that are a part of making sure that you stay healthy and stay around here for a long time. So that would be the advice that I'd give to folks when you're, going for your annual checkups or going to see your family medicine doc, your primary care physician, is to go in with the thought in mind already of what you want to get out of that visit, and really set the goals for that visit, set the stage for that visit, and take charge of taking care of your health.
Yeah, I love that, learning to advocate for yourself and have agency over your own body, right? That's the most important thing, so
So
I think
important.
that, it's great to go in with some questions, finding a provider that actually listens to you. I think that will make your whole journey, your health journey much, much better, right? When you can walk side by side with your doctor. I think that's really important. So for all those people that are listening, that are thinking, wow, Dr. Brittany Anderson is fantastic. I love her so much. I want to be I want to be her patient. I'd love for her to, I'd love to walk alongside her for my healthcare journey. How can they get in touch with you?
Yeah, so my practice is in Alabama. So if any of your listeners are in Western Alabama, we are here, and the practice is called Anderson Family Care. I have a podcast as well, and I just provide a lot of general health information for women who are 40 and beyond, and who have just an interest in being healthier. So women who lead really busy lives, have spent so much of our lives taking care of other people, but now want to really get on top of taking care of ourselves as well. So that podcast is called Headed to Healthier, and it's available on all podcast platforms. So you can certainly find me there. And again, I have some wonderful guests, yourself included, who have come on the show. And so, the shows are a mix of me doing a solo show and just talking about health topics, or bringing on experts in their fields. And so, again, I was humbled and grateful that you came on as a guest for the Headed to Healthier podcast. It was so fun to have you. And so that is where folks can find me. If I'm not in clinic, I usually am here recording podcast episodes.
It's amazing. I love it. So, well, thank you so much, Dr. Anderson, for coming on and sharing your knowledge, sharing your wisdom with us, and for telling women, what to expect during their visits and what to focus on and how best to get care and advocate for themselves. So, thank you again. Thanks so much for coming on. And well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. If you have any questions about your health, make sure you go see your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.